parameters you set weren't met.
Right.
Okay? And then if there's pain present, it's a 0. Again, goal is to develop a minimum level of competency, right? Those are 2s, right? So 2 is your base minimum. Like that's where I'm saying, okay, this person can at least do this, right? And then dysfunction is what we consider a 1, right? So we're not aiming for perfection, right? And that's why they have the big foot up there.
Do you ever have people do this barefoot or in socks, or they always wear shoes?
Absolutely, I have them do barefoot a lot. Now, sometimes if it's the string floor upstairs, I'll just leave their shoes on. I'd say probably if they're going to take their shoes off, go ahead and just take their socks off, because the socks are going to slide on that board. And if it's a floor like this, or if I have them do it on the tile, then their feet may slide. I never do it on a mat though, because the mat compromises balance. So if you were doing rotary stability, if you were doing deep squat, that mat's going to have some absorption of your movement. So I'm not going to see a completely organic movement from that. So I always want to make sure it's a firm ground, and that, again, you're facing away from a mirror or any type of reflection. So this is basically the parameters around pain, right? So you can't predict how it's going to compensate. It's still a 0, even if they do the movement perfectly, right? Because there was pain present there, right? So, and we always ask, is it painful, or is it just stiff, or is it tight, right? Just to see if they can discern between the two. And if they're adamant about it being painful, then it sticks with the 0, right? And then again, just kind of referring out just to make sure that, there's nothing like a torn, rotator cuff or something going on with the labrum or something like that.
Right.
So again, setup must be exact, stick to the rules. Repeatable, reliable, interchangeable, right? So repeatable, my setup, making sure I can come back to the same thing every time, making sure that I know I'm confident in my cueing, and that I know that what I'm saying is something that the person can at least resonate with, so they can go ahead and complete it. And interchangeable, that kind of goes to what I was talking about with the exercises that go along with it, right? If it's something that they're having trouble with, like an active straight leg raise, maybe I know some regressions or some modifications that I can make right off the bat in their program that will allow them to feel confident in that movement pattern. So then when we come back to it, maybe it looks a little bit better. That's just, where you at, where's your base movement. Those are the names of the screens. Just remember those. So, and again, I'll send this to Jen, and I can send it to you all as well. This is basically just what the purpose of the screens are, right? What are we looking for out of the movement pattern? What's the reason that we even have it in there in the first place? So static and dynamic control of the hip, pelvis, and lumbar spine, core stability in a symmetrical stance position. So again, that goes back to what I was saying with the trunk stability for you. So in that symmetrical stance, maybe it was compromised because of your trunk stability, right? Because your hips weren't in question. We saw that from your active straight leg raise, neither was the pelvis, and you didn't have any pain in the lumbar area. So that leaves it just to the core stability. Maybe that was the issue. So these are the cues, right? This is what FMS decided were the cues. This is why I was saying find your own language with it, so it doesn't sound so robotic, because also it's hard to really remember all the words up here. So if you're trying to think, stand tall with your feet approximately shoulder width apart and toes pointing forward, like that's way too much. Like, just figure out, like, what in your head does this look like, and how do I talk like that? Like, how am I going to communicate this to somebody without it being so wordy, right? So that's what we tell everybody upstairs is find your own pitch for this, but make sure that you're not deviating from the rules. So whatever it sets as the parameters, make sure how you're saying it still portrays that without having all the words in there. So those are your scoring criteria for deep squat. So they say dowel aligned over feet. I say shoelaces because feet's very ambiguous. That could be your toe, that could be your heel, but I like shoelaces because that's where it starts off, right? When you're holding it over your head, it's above your shoelaces. Knees over feet, femur breaks parallel to the ground. So 3 if they're perfect in all the above criteria. They get 3 attempts. If they fail, they have 3 more attempts with heels elevated. That's why I did 3 and 3 with that one. If they're successful, they get a 2. If not, they get a 1. purpose for the hurdle step.
So with the hurdle step, you're really looking more for like gait mechanics?
Mm-hmm. So maybe your ankles also came out in the hurdle step, right? So maybe if that's something that we address, then again, your big three are the last things you should address as far as correcting that movement pattern. Whatever you do in those first four probably will then relay back to these, so when you come back to screening, they look better anyways.
Mm-hmm.
I've never had to correct a hurdle step, inline lunge, or a deep squat, because whatever I did with those other screens usually fixed one of those. Scoring criteria: scoring the moving leg, knees, hips, and ankles remain aligned in the sagittal plane. So if you see that swing, right, they're breaking outside of that sagittal plane.
Mm-hmm.
Minimal to no movement noted in lumbar spine, so you had a little bit of rotation there. That's what we're looking at. Dowel and hurdle remain parallel, right? So we're trying to make sure that we're not seeing this either. Scoring, inline lunge purpose, rotation, deceleration, and lateral type movements. So when you're coming to the ground, is it a fall to the board, or are they actually able to lower down under control, right? It's a little bit of a mix between mobility and stability. So, dowel contacts maintained, head, shoulders, low back remains vertical, feet and dowel remain in the sagittal plane, so there's nothing here, right? You'll see a lot of times people like to rotate that leg back there, right? No torso movement, right? Forward, back, side to side, back knee touches the board behind the front foot. So I said board or floor. I've been through FMS workshops since they came out with this, and the people who actually developed this said that if the knee touches the floor, it's still fine, right? That's actually even better than if it just touches the board. Shoulder mobility. Rhythm of scapulothoracic, T-spine, rib cage. The setup. Scoring. So again, this is what I was saying. Score is determined by distance between hands. 3 if the fists are within 1 hand length. 2 within 1.5, and then a 1 if they're greater than 1.5. There's your clearance test. That's where I had you hold the pin. So it's all, you always want to do your clearance test after that part of the screen. Because if you do it before, you may compromise the screen. Because if there's pain in this, then you're definitely going to feel it with this. Active straight leg raise. Separate lower extremities in an unloaded position. First movement skill learned, the precursor to higher level movement. So again, that goes back to the developmental kinesiology I was talking about. Pure mobility of the hips relative to each other, right? Because you should have independence in both of those movements, rather than when this one lifts and the other leg tries to lift up. That's why I use that lottery ticket analogy, because if you had that leg relaxed, it may want to bend as you lift the other leg.
That's a good key.
Some people, they'll say lottery ticket is a $100 bill. It's just something to cue that they keep that knee flat.
So Stan, this would be the first exercise that would be in terms of like not self-correcting, like the first 3 would probably self-correct if from here and the other ones started to improve.
Based on your scoring, so I'm gonna give you, I don't wanna confuse you here, but I'm gonna give you a hypothetical situation with someone. So let's say their active straight leg raise was a 1-1, and let's say their shoulder mobility was a 1-1. Your active straight leg raise is the first thing that you approach, right?
Okay.
Because both of those are 1-1s, but the active straight leg raise is higher on the priority, right?
Okay, so this is all done in priority, as in
based on scoring and movement, right? So now I'm gonna throw something else in there. So let's say the active straight leg raise is a 1-1, and the shoulder mobility is a 2-1. I I approach the shoulder mobility first. Not because it comes first in the hierarchy, but because there's an asymmetrical dysfunction, right? Because one side is moving better than the other side.
Okay.
So I need both of those to either be 1-1s or 2-2s before I go back to trying to fix the active straight leg raise.
Okay.
Does that make sense?
Okay.
Because now that person's at a higher risk of injury in their shoulder mobility because one shoulder is not able to move as much as the other one is.
Okay.
Does that make sense?
Yes, it does.
Right. So ideally, if every score looked the same, active straight leg raise comes first every time. Right?
Okay.
But based on scoring, if there's a dysfunction there, then I score or I correct based on the asymmetrical dysfunction.
Okay, as in right shoulder is a 2, left shoulder is a 1. Okay.
So I go for shoulder mobility and then I come back to active straight leg
But
raise.
if they were both 1-1s or both 2-2s and the straight leg was 1-1, you do the straight leg first.
Straight leg first.
Then okay, I got it. I got it.
So now, I'm still, so you're with me, I'm going to
Yes.
throw in one more, right? So let's say the active straight leg raise is a 1-1, the shoulder mobility is a 1-1, and the rotary stability is a 3-1, right? Rotary stability comes first. Because now one side's perfect and one side is dysfunctional, right? And it's a greater difference when I see that 3 and the 1 than a 2 and a 1. Right? So the discrepancy between the two sides, it trumps that, right?
Got it.
So even though one of them is a 1-1 and it hasn't reached the 2 yet, right? I still go for that big discrepancy first. That's a huge red flag because that's telling me that you feel 100% fine on one side and there's something that's messing that movement up on the other side. Now I've never seen that happen with rotary stability, but I just wanted to use that as an example that your scores dictate what you would approach as your red flag first.
Got it.
But more times than not, you'll see it where the active straight leg raise is it's either that or shoulder mobility is one of your first approaches.
So you correct a balance first and then correct
Yes.
from dysfunction to function.
Yes, make sure both sides are the same and then go for hierarchy of the movements.
Got it.
The scoring criteria, straight leg raise. So again, vertical line of malleolus, just looking for that ankle, across the dowel. Non-moving limb must remain in neutral position. Again, that lottery ticket analogy. Trunk stability, purpose of core stabilization, right? So you see how he's in this position. Obviously, you're not seeing where he pressed, but ideally, as he presses off the ground, you want to see all of that in that same line. You don't want to see a dip through the lumbar or any type of adjustment through his body, and he just presses straight up, just like that.
That was it. I found that to be really hard.
It's the hardest one.
Why does it have to be so hard?
So if you think about like extension exercises or like, have any of you ever had to move a refrigerator? Right? So if you're thinking about like moving a refrigerator, it's like really tall, but obviously like you're extended through your core as you're pushing and activating. Sometimes when you do things like that, if people don't have a strong enough core, they're gonna go here, right?
Yeah.
And immediately all that pressure goes to their lumbar spine. So we need to see if you're confident enough in your trunk stability to maintain a tight core as you press up off the ground so that you can protect your spine when you're in that position.
But that's a
Yeah,
fundamental.
It was just very aggressive.
It is.
I mean, I found it to be, it did exactly that.
Right.
Even though I prepped and I was like, right, okay, this is, we get that transverse done. It was just like, whoa, that's a really aggressive first.
Right. So, but now if you think about if you have something really heavy that you have to pick up or move, you need your motor recruitment to be there in order to do that, right? So with that exercise, out of all the other ones, that's the only one where you have to like basically, all right, is everybody ready to go? Now let's lift up off the ground, right? So you have to have everybody on board, all the motor recruitment in place as you press your entire body off the ground. So then that preps your core stabilization for lifting heavy objects or moving heavy objects.
So again, the female's here, right?
Female starts here, then goes here.
Male is up here.
Male's here, and then here. So male, forehead, nose, female, chin, clavicle.
But that's following progression of movement too, because you're going from distal to peripheral. So we're going ahead and putting them in that. Let's go ahead and challenge them and see what kind of movement we get in that.
Right, because let's say
extension, that
if I went closer first and you were fine, maybe you're a little fatigued if I go further away. So
Right.
then I don't get the true